What is night eating syndrome? Night eating syndrome, NES, is a complex eating disorder characterized by a pattern of recurrent episodes of night eating, typically involving the consumption of a significant portion of daily food intake after the evening meal and/or during nighttime awakenings. Individuals with NES often experience a lack of appetite in the morning and may skip breakfast or consume minimal food until later in the day. Understanding the features, causes, and treatment options for night eating syndrome is essential for effective management of this condition. Here's what you need to know. Features of night eating syndrome include nighttime eating, where individuals with NES consume a significant portion of their daily food intake during nighttime hours, often waking up to eat or feeling compelled to eat excessively before bedtime. NES is characterized by a lack of morning appetite, with individuals often skipping breakfast or consuming minimal food until later in the day. NES can cause distress or impairment in social, occupational, or other areas of functioning due to the disruption of normal eating patterns and sleep disturbances. Causes of night eating syndrome include biological factors such as abnormalities in the circadian rhythm, hormonal regulation, neurotransmitter function, or appetite-regulating hormones such as leptin and ghrelin. Psychological factors such as stress, anxiety, depression, and other psychological factors may contribute to the development or exacerbation of NES. Environmental factors, including irregular meal timing, exposure to food cues during nighttime hours, and disrupted sleep patterns may also play a role in the development of NES. Diagnosis of night eating syndrome involves a clinical assessment, including a detailed history of eating and sleep patterns, physical examination, and evaluation for co-occurring psychiatric or medical conditions. NES is diagnosed based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, including recurrent episodes of nighttime eating, morning anorexia, and distress or impairment related to the eating pattern. Treatment options include cognitive behavioral therapy, CBT, which can help individuals with NES address maladaptive eating and sleep patterns. Certain medications, such as selective serotonin reuptake inhibitors, SSRIs, or medications that target appetite regulation, may be prescribed to help manage symptoms of NES. Working with a registered dietitian can help individuals with NES develop a balanced eating plan, establish regular meal times, and address nutritional deficiencies or imbalances. Lifestyle modifications include establishing regular meal times, eat meals and snacks at regular intervals throughout the day to prevent excessive hunger or overeating during nighttime hours. Limit exposure to food cues. Minimize exposure to food-related stimuli, such as television commercials, food advertisements, or late-night snacking opportunities, to reduce the likelihood of nighttime eating. Night eating syndrome is a complex eating disorder characterized by recurrent episodes of nighttime eating, reduced morning appetite, and distress or impairment related to disrupted eating and sleep patterns. By understanding the features, causes, and treatment options for NES, individuals can seek appropriate support and interventions to manage symptoms effectively and improve overall well-being.